This all goes to show how diet, lifestyle can then affect the microbiome, which then it makes our protection work poorer. Then we have a metabolic issue because the highly processed foods make it easier to gain weight, become obese. There's a large, obesity epidemic in this country, which then causes biologic dysfunction, which then can lead to all, not just colon cancer, but all types of cancer. Now, that sounds doom and gloom, but it's actually empowering.
According to the American Cancer Research Institute, there has been a 2% annual increase in colon cancer cases in adults aged 20 to 39 since the 1990s. We know that those of you listening are very health aware and take strong advocacy towards your own health trajectory. Rather than cause fear, today's episode with our expert guest will help you feel more confident using evidence-based tools to reduce your risk for colorectal cancer. Joining me on the show today is Dr. Zuri Murrell, who is a colorectal surgeon and colorectal cancer advocate. Welcome to the show, Zuri.
Hey, how are you today? Thank you so much for having me. As you know, I'm very passionate about this because there are things you can do to decrease this risk, and what I love to start off with is basically telling patients, what if I told you that there'll be 150,000 newly diagnosed cases of colorectal cancer? And there'll be roughly 50,000 deaths. And 10% of these colorectal cancers will occur in people under the age of 50. But it's almost totally unnecessary. Now, how does that make sense, right? Like what I just said, those numbers versus it's almost totally preventable. And we're going to talk today a little bit about why this is happening in younger people, but also things you can do, as you were saying, to help to stem the tide of this epidemic.
Absolutely. Yeah. It's so great to have you on and share your expertise and passion with us. And like I said, help people to feel more empowered of what they can actually do and not feel so fearful about these statistics. Because as we both know, there's a lot of things that you can do to lower your risk as well.
Exactly.
Just to get started, I'd love for you to tell us more about yourself and the role that you play as the medical director of outreach and quality integration at Cedars-Sinai Medical Center.
So I'm very excited about that role because I get to do what I love best, which is talking. I get to go to different churches, different groups, different community centers, and basically spread the word about this preventable disease. And I'm trying to take the stigma away. There's typically still a stigma when it comes to colorectal cancer. And it's interesting because I hope to change that one day. My mom, unfortunately, passed away from breast cancer. And now we know that there's really no stigma with breast cancer. Breast cancer, now people are able to talk about it all the time. When my mom had it, it was like colorectal cancer. Nobody talked about it. It was embarrassing. It was things of that nature. And through advocacy, we were able to change that. And, it's important in terms of colorectal cancer because it affects men and women alike. About 4.4% lifetime risk for a male and about 4.3% lifetime risk for a woman. And it's so prevalent that it's actually that when you take men and women, it's actually the number 2 cause of cancer-related death in America. So this is very, unfortunately, common. And unfortunately, it still is kind of a taboo subject. And so I get to not only go out and talk to these communities, but we look at what barriers there are in terms of getting screened and trying to kind of break those barriers down. And that's what's really important.
Mm-hmm. Yeah, definitely. I can imagine that there's more awareness about it now, but definitely it's still something that maybe people don't feel comfortable talking about. And then as we'll get into even doing screening or talking to their doctor about the symptoms that they may be experiencing just for fear or embarrassment, right?
Embarrassment, exactly. And I always say you shouldn't die from fear and you shouldn't die from embarrassment. And, this is what's often happening.
Yeah. So just so we're on the same page, maybe you can briefly explain what colorectal cancer actually is, just so that we know what we're talking about.
I'd like to explain it is all cancers basically the cells become stupid. Okay, what does that mean? The reason my fingers are this long and not this long is because cells know when to stop growing. And cancer cells lose the ability to stop growing. So colon cancer, these cells in the colon lose the ability to stop growing, and they keep growing, and they grow so large that they take the nutrition and the energy basically from the body. They outgrow blood supplies, and so they break off, and this is why you have bleeding. The reason people lose a lot of weight, once again, is because the normal body is not getting the nutrition. The cancer cells, because they grow faster, are basically getting this nutrition. And that's what cancer typically is. So the colon's about 5 feet, and then the rectum is about 15 centimeters or so. I always tell people that the job of the colon is not to make poop. That's what everybody thinks. The job of the colon is actually to reabsorb water, okay? And the job of the rectum is to hold the waste until a socially appropriate time to defecate. And so when these organs are affected by cancer, that's colon and rectal cancer.
Awesome. And I feel like these days, just with social media, and I think maybe in younger generations, there's a lot more talk about conditions like IBS or SIBO or different GI conditions, which in a way is a good thing because then we have a bit more information and people feel more comfortable talking about it. But something that I see just in the IBS population is that a lot of people are more commonly self-diagnosing. So they may think that they have IBS because they're experiencing symptoms like bloating, pain, changes in stool, bowel habits,
Right.
and all that. But as you probably would agree, that sometimes that might mean that people are not getting the testing or getting more investigations done and making sure that it isn't something more serious like colorectal cancer. Yeah.
Exactly.
So with that, what would you say are maybe some warning signs or symptoms that people shouldn't ignore?
Okay, so one of the major symptoms, especially in people under the age of 50, we see a lot of left-sided and rectal cancers. Okay, and when I say a lot, so it's still more common to get colorectal cancer above the age of 50. However, we've seen this 12-fold increase in people under the age of 50, and there's some reasons why, but I just want to be clear on that. Now, one of the biggest symptoms is rectal bleeding. Now, most rectal bleeding is from hemorrhoids, and all of us at some point will probably notice a little blood on the toilet paper. When does it become an issue? Well, number one is when you see when you see bright red blood, often it is hemorrhoids. But you buy some over-the-counter medications. You try that for 2 weeks. It's not getting better. You need to see a physician. Okay. If a patient has blood mixed in stool, often that's an automatic colonoscopy. We feel that there could be bleeding that's higher up in the GI tract, okay? And that can be caused by diverticulosis, that could be caused by inflammatory bowel disease, sometimes IBS, different colitis diseases, but that's an automatic colonoscopy to see what's going on. Another symptom is unexpected weight loss. So people who are losing weight relatively rapidly, about 5 to 10 pounds a month, and they're not getting better and they're trying to eat and they don't know why, that's another sign and symptom. Something else that's very, very important is changes in bowel habits. So let's say you go to the bathroom like clockwork every day, 8 o'clock in the morning, you have your bowel movement, and all of a sudden it's every 2 days or every 3 days. Now, we can have little bumps in the road and constipation, but I always like to say that you can try over-the-counter remedies for 2 weeks or so, 3 weeks to see if it gets better. And if not, you need to see a physician. Now, the hard part with this when you're under the age of 50 is that you have to make sure when you see a physician that you have a thorough examination. So if you have rectal bleeding, someone needs to look in your rectum. Once you're in a physician's office, it shouldn't be, it's probably hemorrhoids, it's probably this, it's probably that. And often that's what happens a lot to younger patients, okay? And so that's why it's important to kind of know these symptoms. Now, abdominal pain, and once you understand these symptoms, have a communication with your physician to to have a plan. Say, doc, you're going to prescribe me some medications. You didn't take a look, but if these medications don't work, when do I see you again so we can do a more thorough examination? And something else is abdominal pain. Now, a lot of times when you start having abdominal pain, that could be a little not too late in the game, but that is often a sign, if it is related to cancer, that it is a more advanced cancer. So we all can have abdominal pain off and on, but if you're having abdominal pain lasting longer than a week, that's something you need to be evaluated for. Okay. But these are signs and symptoms. And the hard part is these are not specific, right? In terms of we can all have these symptoms every once in a while. So the key is noting the date, noting the time, the length of time you've had this. I don't mind patients trying over the counter, remedies, but the key is if it lasts longer than 2 weeks, unless it's abdominal pain, if it lasts longer than 1 week, you need to be evaluated by your physician.
Yeah, that's a really good message there, because I think a lot of people might push those off, and especially in younger populations, maybe doctors aren't as caught up in the research and aware that, it is occurring more often in younger people, and we shouldn't just be, pushing it off. Like you said, doing an actual physical examination if someone is experiencing blood. So it could be like either dried blood and stool as well as fresh blood could be associated.
Right. So bright red blood is typically outlet bleeding, and then or darker maroon blood is typically from higher in the GI tract. Right. So you can't really see the blood mixed in stool causes of that just in the office. That's typically the colonoscopy.
Right.
But when a patient comes in with bright red blood, you look in with a small scope called a proctoscope, then you look in with an anoscope. And I know these aren't fun procedures, but these are easily tolerable. And you're able to see what disease pathology is going on. If I look into the anal rectal area and you're complaining of bleeding and I don't see any hemorrhoids or any fissures, then that's a colonoscopy, so I can see what's going on.
Yeah, that makes sense. Awesome.
And people don't understand, and I know we'll talk about it, but colonoscopy is really the only test a man or woman can have that actually prevents cancer. And we'll talk about that. That's what makes that tool so powerful.
So colon cancer is considered the leading cause of death in adults under 50 in the United States.
The leading cause of cancer-related deaths.
Cancer-related deaths.
It's really in men. In women, it's close, but it's still breast. Okay. It's the leading cause in men under the age of 50, and it's the second leading cause in females.
Wow.
Under the age of 50.
Okay. And your own thoughts or what you've seen in practice and in the research, what do you think is maybe contributing to these higher rates in younger people?
That's a great question, a complicated question, because we don't know the exact cause, but it's a multifactorial. So the way I kind of look at it is, first you have diet and lifestyle. Okay. So these generations and the way our unfortunate, I always like to say that America is a land of plenty. And we have more food here than we know what to do with it, but 80% of it is garbage. And what does that mean? Highly processed foods. Our diet now, and has over the last 20 years, has become more reliant on highly processed foods. So 75% of kids under the age of 18, 75% of their diet is made up of these highly processed foods. And that is, that's very harmful. Okay. I don't blame the parents because it's so plentiful, and you've been working all day, your kids, you smell different fast food, as you drive home, the kids want it. It smells good, tastes good, but long-term it's detrimental. So these highly processed foods include red meat, includes, low fiber diets. Basically, I always say the most processed food, Cheetos, something like that, where I always say, what's a potato chip made out of? Potatoes. What's a corn chip made out of? Corn. What's a Cheeto? Exactly. So it's literally processed chemicals. And it's hard because highly processed foods are geared toward making us want more. It's almost like an addiction. And so that's one of the biggest issues. Now, why? It's because literally these processed foods contain chemicals. Okay. And these chemicals can affect our microbiome, which is kind of our gut bacterial homeostasis. It literally can increase the amount of hormones that are produced that cause us to absorb more energy than we need, leading to obesity. Okay. And they just cause frank inflammation. So that's number one. Number two is obesity. They say that about 70% of millennials will be obese by the age of 40. Now that's amazing. Now, in a negative way. Um, why is obesity bad? So obesity creates a pro-inflammatory condition in our body that makes the body just a ripe for the growth of cancer. So it causes increased absorption and IGF, which is a special hormone that increases, and this causes a inflammatory reaction in our body. So our body, the way I like to explain it is that our body is always fighting itself. We used to think fat cells were inert, meaning they didn't do anything; they were just there. But they actually produce these pro-inflammatory chemicals. Now, something else that's done is that we really are starting to study is this microbiome. So the microbiome, once again, is that when you look at our protection of our bodies, okay, we're bombarded with different chemicals, different environmental factors every day. But our skin is our biggest protector, followed by our gut from the mouth to the anus, okay? And so there's bacteria that line that. And we live in a perfect homeostasis, meaning that I don't like to say there's good bacteria and bad bacteria, but everything is equal. And the problem is, number one, highly processed foods cause a breakdown in the barrier between and in the protective layer between the toxins that are in our gut and our actual colon. Okay, that's one of the biggest things that occurs. It literally physically can cause this, just what's in the chemical. Secondary, low fiber diet. So fiber actually is protective. Fiber helps to increase the barrier, the immunologic barrier to toxins. And when you eat a low fiber diet, obviously that decreases. Now, the homeostasis of the bacteria, a lot of these processed foods target certain bacteria and you get an overgrowth of other bacteria. And we're noticing when you get this overgrowth, you can find these particular bacteria in different parts of the colon that are associated with colon cancer. So this is all goes to show how diet, lifestyle can then affect the microbiome, which then it makes our protection work poorer. Then we have a metabolic issue because the highly processed foods make it easier to gain weight, become obese. There's a large, obesity epidemic in this country, which then causes biologic dysfunction, which then can lead to not just colon cancer, but all types of cancer. Now, that sounds doom and gloom, but it's actually empowering. It's empowering because guess what? You can try and decrease the amount of processed foods. Now, the hard part is that I do a lot of outreach in stressed communities, and it's hard because that's the cheapest food. Highly processed food is cheap. However, there's more, able to eat more vegetables, more fruit, things of that nature, things that are high in fiber. One of my favorite sources of fiber is blackberries, blueberries, raspberries. And that is a great source of fiber. And even frozen berries, which are cheaper than fresh berries, still have this fiber content. So that is one of my favorite ways to get fiber. But high fiber diets can be protective. Decreasing red meat. Red meat in and of itself is a procarcinogen, meaning that in and of itself, it can lead to cancers. So decreasing red meat consumption, increasing your overall fruits and vegetables, decreasing sodas, for instance, that can also have a huge impact in terms of helping to prevent colon cancer. So that's number one. Number two is that physical activity. So once again, physical activity helps to decrease obesity. So decreasing that abdominal fat can actually decrease the inflammation in our bodies, which can decrease the risk of colon cancer. And so these are powerful tools, yet it's very hard. It's very difficult in a world that is bombarding you with eat this, eat that. It's very difficult in terms of younger people, younger than the age of 50, people aren't going outside anymore. People are always on their devices. And, that in and of itself can lead to obesity. People aren't playing as much. But something else that it leads to is vitamin D deficiency. So there's a huge vitamin D deficiency in this country. Vitamin D is made when the sun hits our skin, and the hormone is made via our skin. Vitamin D deficiency is rampant because most of us aren't working outside. Most of us, a lot of us aren't going outside. Why is that important? Well, vitamin D helps to prevent cancers. It helps to strengthen your immune system. And it's so important. And that's something that you can do. We can take vitamin D. There's a million different sources of vitamin D, whether it's over the counter gummies, vitamins, things of that nature. And that's something that everybody should do. I have my kids taking vitamin D. I tell everybody, they should take vitamin D. Vitamin D deficiency is actually a cause of depression in kids and in adults. It can literally change your life on multiple levels. So that's very important. Now, alcohol consumption. Binge drinking is a problem in this country, and alcohol consumption, we know about smoking, obviously, but there's a dose-dependent curve for alcohol consumption, meaning that the more you drink, the higher chance you have of getting colorectal cancer. So this is something else that needs to occur, not just in dry January, but all the time. Now, these are all very important ways that can decrease your risk. But I tell people that, and I want to talk to parents. All of these problems with these dietary changes start when we're kids. And it's very hard because this is what we're getting fed. If, as a parent, the biggest thing you can do is trying to decrease, the processed foods, increase the vegetables, increase physical activity, and do it while kids are young, because then when they grow, this will be their lifestyle. And you will actually make a bigger difference because you won't be playing catch up, so to speak, as we have to when we get a certain age. I'm playing catch up from, my bad habits that I had in the past. And I think that this is something that, is not often discussed. I always say that the best time to talk about colorectal cancer is at the dinner table when you are shoveling food in your mouth. And my dad, who passed away recently, that was always the joke. He's like, why are you always talking about, colon and rectal? It was the word rectum that bothered him. Colon is not a problem, but the word rectum and anus bother a lot of people. But he's like, why are you always talking about what you do at the dinner table? And I'm like, because that's when you make the biggest change. When I talk about colorectal cancer at the dinner table, you look at your meal. Do I have more green than I have red meat? How much am I eating? All of these things are very important. And I tell people it's not important to just stop. Okay, but it's important to limit it. If you eat red meat 5 times a week, go to 2 times a week. Any of this can help. Increase your vegetable consumption. Little changes actually over time last longer. When I give one of these talks and people say, I'm going to be a vegetarian, I'm going to be a vegan, X, Y, and Z, I know that that's a fail because, you can't just turn it on like this. It's little changes make a big deal. Okay, if you eat, Cheetos every day, go to 1 time a week, things like that can help make a long-term difference. And you'll notice that, you'll feel better also.
Absolutely. Yeah. Great points there. And we know that our microbiome is influenced by what we do over time. It's not just going to change, in a day of eating a salad, or just, if you eat well and you have Cheetos one day, it's not going to disrupt it. It's those patterns over time, right?
Exactly. And the best way to start those patterns is when you're young, but you don't do that unless someone tells you.
Mm-hmm. Yeah. And I have read I'd have to find the reference for it, but I think there was a study that looked at microbiome patterns like through the lifespan in different generations. And I think it's easier to rebuild or improve the microbiome within a generation, but it does get harder if maybe your parent didn't have a very healthy microbiome and grew up without a very good one. It can be harder as in the next generation to fix it. Like you said, it's good to think about it even with your kids. And
and I think it's also habits. Like if you grew up eating a certain way, then your kids are going to, often eat that way, unless you have, an epiphany, or you're able to look at some of the data. And if you're blessed enough to have the financial resources to be able to change how you eat, because that's a different kind of problem. But in stressed communities, you see an increase of these cancers most likely because of the financial burdens. What I tell people, sometimes they're like, well, doc, does this really matter? Well, it's interesting because, I do medical outreach in Africa, for instance, in Uganda. And Uganda, they weren't having any colorectal cancer. Now, people work outside, so they're getting a lot of vitamin D. There's low red meat consumption. There's high fiber consumption. But now what you're starting to see in countries like, Nigeria and Uganda, you're starting to see more cancers and obesity among the rich Ugandans and rich Nigerians. Why is that? Well, because we're exporting our McDonald's and our fast foods, and that's what they can afford. Only the rich people can afford it. But you can actually see cancer clusters go up based on the fast food we export. And so that is yet another sign about how processed foods can affect us. And so that's one of the things and once again, it affects us in multiple ways. Obesity and gut microbiome are the major ways. Physically, chemicals hurting our ability to fight cancer.
Mm-hmm. Yeah, I want to bring it back to about the point about vitamin D. Like you said, I think, here in northern latitude, North Americans, we are seeing like an epidemic of low vitamin D, or it's been talked about more, I would say, in the last few years, and people are more aware to supplement with it. But something that I see is actually when people are taking quite a bit of supplementation, but their levels aren't coming up. And typically a big reason for that is not getting enough cofactors, because vitamin D is one thing, but getting enough magnesium, zinc, vitamin K2 is important to help the body absorb and properly metabolize vitamin D. So it even goes back to that point about eating real foods and foods with more nutrients, so that we are able to get more of those other nutrients in our diet too. So it kind of works together. And even the state of your gut microbiome impacts how you absorb nutrients and getting enough from your food. So it's all kind of linked.
I mean, I recommend multivitamins at this point too to help, because it's hard. It's hard to eat right all the time. But yes.
Yeah. For a lot of people too, it can just be helpful as a kind of an insurance to make sure.
Insurance.
Yeah. Sure. But yeah, to the point about highly processed foods, or do you know the NOVA classification?
I mean, I don't know what I'm talking about, but yes, I've heard and I've read about it. I don't know it off the top of my head, but yes.
Okay. Yeah. So there are, I guess, distinction between processed foods and then ultra processed foods. So some processed foods, can be good and healthy for us. So things like canned chickpeas, obviously there's a little bit of processing there, or
it's a plant-based process. It's like a plant-based almost processed food versus, because everything has to be a little processed in order to keep shelf life, things of that nature. Whereas ultra processed foods are typically foods that are, I believe it's 75% chemicals, that aren't, you won't find out in nature, so to speak.
Yeah, I like to think about it as it just doesn't look like its original form. Like if you look at a Cheeto, without knowing, ever looking at the ingredients list, you don't know what's actually, what was it made from, right?
Yes.
Versus a roasted chickpea, it still looks like the original.
Like the original. That's a good way to explain it. I'll use that. Do you mind?
Yeah.
When I give talks, I'll use it. I'll give you a shout out.
Okay. That's good.
Going back to what we were talking about a little bit about the signs and symptoms of colon cancer and colorectal cancer. When we discuss it, we see that it's kind of non-specific, right? A lot of us can have these issues, and it's not a cancer. So how do you know when it is? And it's not only the length of time, but I think, and this is something that even us as physicians need to work on, is even thinking that it's possible that somebody under the age of 50 could have this disease. Right. And so 10% of colorectal cancer is in people under the age of 50. And that's huge. That's enough for us to warrant a look-see, so to speak. And so one of the biggest reasons that we're seeing a slightly increased mortality in patients under the age of 50 is that even when they go to that they're diagnosed late. So often when you go to a physician, if it's not in a physician's mind, then you're not getting that one test that I talk about that prevents colon cancer, which is a colonoscopy. So all colon cancer starts as these growths called polyps. And when you do a colonoscopy, you see polyps and you could take it out before it becomes a cancer. Now, greater than 90% of the time when a young person gets a colonoscopy, it's a diagnostic colonoscopy. It's not screening, meaning that we're looking for a problem. And so, I'm a big proponent of early screening. Um, this can be done. Uh, However, it has to be done if you know your family history, and you know your family history is positive, not only for colon cancer, but colon polyps. That way, it's even easier to get, a colonoscopy. But I tell patients it's important to be your own healthcare advocate. And if you're having these problems and they're not getting better, you should insist on that to not only find out what problem is going on, but you may find other polyps that you can remove so it doesn't become a cancer. But this test is very powerful. People ask me, what about the stool tests? Stool tests are good at finding cancer, but they're not good at preventing it, meaning that they're not necessarily as good at finding polyps. And the whole point is to prevent colon cancer. I believe that the stool tests do have a place, but I believe is after a colonoscopy, if you don't have a history of polyps, and when you get older than the age of 50, then like 80, and if you never had polyps, you don't necessarily need a colonoscopy anymore. But when you're trying to figure out what's going on, especially with patients under the age of 50, with these persistent problems, and a colonoscopy is actually a prevention and life-saving tool.
What would you say to people who maybe have some resistance to doing a colonoscopy just because of the prep that's required? You have to drink the solution and
Right.
use the bathroom multiple times.
So
And then some people are worried about perforation.
perforation, right? So perforation is incredibly rare, especially screening. It's like one in a million. I mean, it's incredibly rare. And often, if you are perforated, you don't need to have surgery because it's already a clean colon. So, that is something that I know people think about, but it's incredibly rare. Um, what I like to do is I talk to patients, and it's usually men. I think women are used to getting these invasive exams. They're, from the age of 13 when they start seeing a gynecologist. For men, it's often I get a little more resistant. So typically, I'll ask a male, it's time for your colonoscopy. You should get a colonoscopy. And they say, well, doc, I don't want one. I don't want anybody sticking anything in my butt. That's like, just to be frank, that's what they say. And then I say, well, what about your significant other? What about your wife? And what about your husband? Well, they'll be fine. If I die, they'll be fine. I don't want a colonoscopy. But then I'm like, what about your kids? And they're like, well, what do your kids have? What do kids have to do with it? I'm like, well, if we find something in you, your kids will get their colonoscopy sooner. So not only are you saving your life, you're saving your kids' life. They don't have kids. I ask them about their brothers, their sisters, things of that nature. So I say colorectal cancer and colorectal health is a family affair. And that's what it is. Family members, caring about your family members, it's important to get these tests so that your other family members know what's going on and know what's in their history. And cancer is not the only important thing, but polyps. If you have a family history of polyps, some family history of relative has 10 or more polyps over their lifetime, that's an increased risk for colon cancer. So it's, and there's other cancer syndromes that are important, like uterine cancer can go along with colon cancer. So it's important to, as much as possible, know your family history. And I would argue if you're adopted or you don't know, then you need a colonoscopy early, because you don't know. And you need at least a baseline colonoscopy, I think, so you know what's going on. And if you have polyps and things of that nature. And so all these things are important that we discuss because there's things you can do yourself to prevent colon cancer, and there's tests you can do to prevent colon cancer. And you can't say that about breast cancer. We do all these CT scans, mammograms. We do, all of these tests to find cancer, but there's only one test you could do to prevent cancer. And that's really the power of this. There's no reason this needs to be the number 2 cause of cancer-related death in America.
Yeah. You're saying a big part of it is advocating for yourself as well. If you're
Yes.
below the age of 50 and you are having these symptoms, then just pushing your doctor to investigate and
right,
ensure that nothing more serious is
going on. I always say you should work with your doctor. I think it's a team. So I tell patients, I can't love you more than you love yourself. I will work with you as much as possible, but we're a team. I'm not the kind of doctor that dictates what you should do. I want to know your goals. I'll tell you my goals, and we can, come to some understanding. But I do say one of the things patients can do is if they get diagnosed with a problem, this is any problem, high blood pressure, diabetes, whatever it is, let's say high blood pressure. I'm going to put you on this medication. The patients should say, okay, doc, they should leave every appointment with, when am I going to get it checked again? And if this doesn't work, what is the next step? You should always leave an appointment knowing what the next step is, because then that will also give you agency to know if something's working and to know that we have a plan. You go in, the doc changes your medication. If this doesn't work, what's our plan? And I say that for any medical problem, and that's being your own healthcare advocate. It doesn't mean walking in and telling, doctor, do this. And it just like from my point of view as a doctor, it doesn't mean I'm telling you to do this. We're a team. And this will really help increase the quality of your life and the quality of the medicine I practice.
Yeah, absolutely. It has to be a partnership, I think.
Exactly. It's a team.
Yeah, to be on the same part. And yeah, back to the point about fiber preventing colon cancer, colorectal cancer. It's definitely something I push a lot with clients. And as you probably see as well, most North Americans do not meet their daily fiber requirements.
No.
On average to get about half of the required needs. So males,
if they're lucky.
Yeah, if they're lucky. Males need about 35 grams at least per day, and then adult females about 25 grams. In my practice, I tend to see 15 to 20 is probably average intake. Yeah. We bring it up, but there's quite a bit of research around colorectal cancer and higher fiber intakes. Right. Even I pulled a couple, but a 2018 meta-analysis showed that those with the lowest amount of dietary fiber had a 21% higher risk of colon cancer compared to those with higher intakes. And then another 2011 meta-analysis showed that a 10% reduction in the risk of colorectal cancer for each 10 grams per day intake of total dietary fiber. Yes. And 20% reduction, actually, which is interesting, of 3 servings per day of whole grains.
Right.
Further reductions for higher intake. So we know the science is there. It's just getting.
And the way I like to describe it is that we think that's multifactorial, is that the colonic transit time is typically the time that the waste or that the liquid containing waste gets into your colon to the time you expel it. And so fiber decreases, number one, constipation. It helps to pull water in the colon so that you can eliminate quicker. So it decreases the amount of time that the toxins are in your body. But what's also interesting about fiber is that it gives nutrients to the quote unquote good bacteria that's destroyed often by processed foods, so that you can get back in that balance. And that's what's really important also, is that it can literally increases bacteria load that is helpful to prevent colon cancer, increases the secretion of the mucosal barrier that helps to prevent, toxins from getting into our cells. And so it's incredibly important. But also water, 8-ounce glasses of water. Water is very important because water is absorbed from the colon. The colon's number one job is to reabsorb water. So you want to drink enough water for your body and for the colon to reabsorb, and enough water that the water can stay in the colon also to help have a quicker movement. And I think that that's something that, patients, we as doctors always say, 8-ounce glasses of water, each fiber, each fruits and vegetables, but we don't talk about why. And that's what I love about this podcast, is that we're talking about actually why. I feel like if you know the why, it makes more sense to you.
Yes, exactly. That's a good point. I always say fiber and water are best friends.
Our best friends, right? Exactly. They go together.
Yeah. You want to just increase your fiber and stay dehydrated, because then you're going to get bloating, gas, discomfort. So for people listening, like I talk a lot about this a lot with my IBS clients, but even if you have something like IBD or IBS and a bit more of a sensitive gut, there's still ways that you can increase your fiber, focusing on lower FODMAP. Soluble tends to be more well tolerated in IBS. So there's always ways that you can bring it up, and it doesn't have to be just eating bran buds all day. There's different foods that you might tolerate more. To bring it up, and building it up slowly is important too if your gut.
Basically, there's no excuses. There's always something you can do. There's no excuses. No excuses.
Exactly.
I really liked what you were saying when you started off and talking about self-diagnosis with IBS. I see that a lot, and it's just, I cannot harp on how important it is to make sure that that is just not a self-diagnosis because you can be missing something major.
Yeah, absolutely. It's a bit unfortunate here. It's like here where I am in Ontario, less people have access to a family doctor. So I think sometimes people put it off longer than they should, or they avoid even going to a walk-in clinic. But like you said, you don't want to die out of fear. And why not just start that conversation and look into it and make sure everything's okay and not push it off. And I know you've shared a lot of stories too. I think you repost things on your Instagram, which I will link in the show notes. But you've had, you've shown different people who've shared their stories of being really young in their 20s, 30s, diagnosed with stage 3, maybe stage 4, just because they put it off or they didn't think it was an issue, right?
I mean, I can even tell you my story a little bit in terms of, so um, I remember my dad, it was time for his colonoscopy, and he's at a health system here, which shall remain nameless, but are notorious for doing these kind of things. So he's 50, he was 52, and he's like, I got to go for my colonoscopy. So I'm at home, and he drives back. He drives back home, and he's walking in the house. He's like, I can't believe you do this for a living, yada, yada, yada. He's in pain. I'm like, Dad, I thought you had a colonoscopy today. Well, I did. I'm like, no, you didn't. I said, you can't drive yourself home after a colonoscopy. Come to find out, he just had a sigmoidoscopy, which was done in the office. Okay. He had a sigmoidoscopy, and then was told that this was just as good as a colonoscopy. So a sigmoidoscopy is just when you look at the lower third of the colon. Okay. So I had to convince, and you're awake, and it's uncomfortable. So I had to convince him. I'm like, Dad, you need a colonoscopy. They do it under anesthesia. You got to do a colonoscopy. Literally, the end of the scope, let's say, is in the mid abdomen. He literally had 5 polyps proximal to that wouldn't have been seen without a colonoscopy. So they took the polyps out. I used to joke with him, like, I saved your life, Dad. You owe me. I saved your life. Over the course of his lifetime, he ended up having like 15 polyps. So like the next colonoscopy he had in 3 years had some polyps. Now, because I knew his history, I got my colonoscopy at 41. Okay. Now I had to just, unfortunately, I had to just pay for it. I mean, I just knew I needed one at that age. I had a big 2.5 centimeter polyp in my right colon that would have been a cancer if I would have waited to 45. But because I knew his history, I was able to get a colonoscopy, which helped to, save my life. So then he used to always say, see, I saved your life. I saved your life. And, I have 2 daughters. One's 18. The other one's turning 16. They already know when they're 35, they're getting their colonoscopies. And so, that I use that story to say that I'd be giving a different talk, most likely about, my colorectal cancer. But I was fortunate enough to know my family, know my dad, know the family history, and wherewithal to be able to get the test. Now, there's many other stories of patients who've had similar issues, but they can't get the test. Their doctor back in the day, doctors didn't think that this could happen to people under the age of 50. But still, we have certain health systems here, like HMOs, which only allow certain tests at certain times. And so I tell patients that's a us problem. As a doctor, that's a doctor us problem. That's not a you problem. So if you advocate for yourself and you insist on these tests, you'll get them. The problem is that most people don't want to insist on a colonoscopy because of the stereotype or their fear of what it entails. But I tell people, you go to sleep, you wake up, it is no pain involved in this test, and so once again, it's preventative, and that's kind of the biggest kind of takeaway from this. I don't want people to have fear of getting these tests. I don't know how it is in Canada, but the only thing I've been told is that there's a little bit of a wait, I guess, to get certain procedures. I don't know if that's accurate or not.
Yeah, they've changed it recently. I need to actually
Okay.
check the guidelines, but it used to be after the age of 50, you would have to get a colonoscopy. But
Yeah.
if you're low risk, you don't have family history, now it is a stool test.
Yeah, they do the stool test, which
Yeah.
doesn't find polyps, but that's
Yeah.
that's what happened in here a little bit too. So,
Yeah.
I mean, there's still benefit because if you catch colorectal cancer early, it's curable. But you still didn't have to go through surgery. You have to go through all these procedures versus just having the colonoscopy and not really having to go through anything. So
Exactly. There's a lot more pain and discomfort if you push it off
yeah,
rather than just doing the colonoscopy.
yeah.
Yeah, that makes sense. All right. Well, I did want to ask you, just to wrap things up, if there is
Mhm.
one trendy, I know there's quite a few like gut health things online, but if there's one maybe trend out there right now that you actually see as relevant or something you practice yourself, an online gut health
So,
trend.
so this is a little nugget. I get my teeth cleaned. Now, people don't know that getting that some overgrowth of bacteria like fusiform, we find that bacteria in the gut in certain cancers. And so, literally taking care of your mouth, getting your teeth clean, preventing cavities, which is where you get an overgrowth of this bacteria, can help prevent colon cancer. And that's something people never think about. And so, see your dentist.
Okay.
How's that one? That's
Yeah.
something people don't know. And second of all, the carnivore diet is not good. Okay, that's a big trend. And eating solely meat can make you for a while look good on the outside, but it will make you sick on the inside. And that's something else I just wanted to share.
Absolutely. And no, there's no fiber.
Yeah, right, which is the problem. There's no fiber.
Yeah,
So
exactly. That's a good one. Just to wrap things up, do you have anything else to add or anything we didn't?
talk about. No, I think this was pretty comprehensive. I will say that you can follow me on Instagram at Dr. Zuri and on TikTok. And I try to give, it's not just doom and gloom. What I try to give is actual, ways you can help to mitigate some of these risks of colorectal cancer and other cancers too. So I appreciate the opportunity to speak on your podcast.
Awesome. Well, thank you so much for sharing your expertise and passion about colorectal health with us. For anyone listening, if you do have any questions, you can leave them below, and I will add some links in the show notes. And then if you can leave a rating or a review, that just helps us get into the earbuds of more people who want to be proactive about their colon health to hear this episode as well. So thank you so much, Zuri, for joining me. And
Yeah.
for everyone listening, we will talk soon.